Hello everyone. Today I'm going to discuss about the important clinical feature in the clinical diagnosis that is which is called as fever. So I'm going to discuss about the what is the fever, what are the causative factors of the fevers, what are the patterns of the fever, so how the fever is going to be raised, the temperature is going to rise, and what are the causes of temperature rise. So we are going to discuss and in which conditions we can commonly see in the prolonged period of fever. So we can discuss all these things. So coming to the introduction of the fever, actually what is fever? Fever is nothing but is also called as the increased body temperature, the more than the normal temperature. The normal temperature is 37 centigrades. So if it is raised more than 37.2 in the morning time and 37.7 in the evening time, why this difference is there? So normally the temperature is going to be like below the normal, like in low levels in the morning level, and also it may rise because of our physical activity. The body temperature is going to rise. So that's the reason if any temperature more than 37.7 in the evening, we consider that is a fever. And also this fever condition also we call another name for the fever also hyperpyrexia. So pyrexia is a high body temperature. So in many cases, this fever is going to be associated with the other symptoms such as the discomfort and burning of eyes. So it's going to give the burning and of eyes and chills and rigors. So they're going to feel very cold and also shivering, and sometimes it's going to give aches and pains and malaise. So it's going to give the like a weakness. So these are the associated like a features of the fever. So the presence of the fever is definite indication for the proper evaluation. If someone get the fever, so we have to rule out what is the causative factor for the fever. And also it is not, sometimes the fever we cannot find the what is the causative factors. So if there is no exact causative factor, so we have to take the proper history from the patient, as well as we have to like take the information about the history as well as the clinical features, what are the signs and symptoms associated with the fever. Then we have to take the some and also we have to rule advise some investigation procedures. So according to the investigations and physical examinations, so we have to rule out the what is the causative factor for the fever. And also the temperature is elevated by the heat production. So why the temperature is going to increase in the fever? So because of the increased production of the heat, so and also reducing the heat loss. Why it's going to be increasing the heat production, and also why it's going to be decreasing the heat loss. So heat production is increased by the increasing the metabolic rate and also rapid muscular contractions as a rise in the rigors. So these who have the temperature is increased, so they may chance to get the chills, feel cold, and rigors. It's going to get the shivering. So because of these things, so the metabolic activity also going to be increased, and also muscular contraction also going to be increased. Because of shivering, all muscles are going to get the contraction. So because of these things, so the temperature may rise and also metabolic activity also going to be increased. So that is the causative factor for the heat production, and also is going to be bodies becomes high temperature. Why it's going to be the heat loss by radiation is reduced by the peripheral vasoconstriction. So if it is because of the shivering, so cold, if they feel cold, so our body and also blood vessels becomes going to be constricted. The blood vessels become very small. So if there is no like a dilatation, if there is no proper blood circulation, so it may give us the loss of heat loss. So because of the heat is going to be generated again, because of the chill, the body has to maintain the body temperature. So as well as already his metabolic rate is increased, there is no heat loss. So because of these physiological mechanisms, so it is going to, the temperature is going to increase. So if you see how the temperature is going to be increased step by step, or sometimes it is gradually, or sudden rise of the temperature. So if you see that, if any conditions, if anybody having problem with the high body temperature, suddenly raise, in case of sudden rise of the body temperature, within the hours, so we can commonly seen in the pneumococcal pneumonia or influenza. So if any infections, so related to the lung and also related to the viral symptoms, so it may give the sudden changes in the body temperature. or it maybe is a gradual, is a step by step, so we can feel. And also seen in the enteric fever or also is a brucellosis. So it is the temperature is going to be raised in the step by step. So that is the reasons. So who are the working in the clinical, like in the so they have to record either every day, so every, at least they have to record the time to time, so we can easily monitor the, so when they having the high temperature, when they having the low temperature. So when it increases, it sudden changes or sudden high like a body temperature, or it's a gradual increasing the body temperature. So while checking the like body temperature, first most important thing and also most golden rule is we should not wake up the person while recording the temperatures. So in all the patients, the temperature tend to swings during the different periods. So sometimes it's going to be the high temperature, sometimes it's going to be low temperature, depends upon the day-to-day time activities and also in the time period. So it may alter. So how we are going to change this type of fever, we are going to discuss here. If you see the pattern of the fevers, different types of the fevers we can observe while assessing the patients or maybe while examining the clinical conditions. So if you see the continuous fever is the temperature elevated all the times, but difference between the maximum and minimum does not exceed the 1 centigrade. So in case of, so it is going to be in the early stage of the pneumonia. So in the early stage of the pneumonia, this is one example. In these conditions, the temperature is going to be continuous. So from there is no like a gradual changes. There is no like a decreasing the temperature. No, it's a continuous like a fever. Whenever you check, maybe is a my minimum is and also maximum, it will be vary only 1 centigrade. So that is commonly found in the is the early stages of the pneumonia. It's nothing but is the lung infection. And also next one is the remittent fever. So this remittent fever, the temperature is elevated throughout, but the fluctuation is more than 1 centigrade. So, and also this also is going to be throughout they're going to get the fever, but is going to be changes more than, like if you check them, what is the minimum and maximum, it more than the 1 centigrade. So it's commonly seen in the enteric fever, also called as the like a typhoid fever. So they're going to get the continuous fever, but the fever is going to be more than 1 centigrade. And also next one is the intermittent fever. So this intermittent fever is going to be the temperature rises as well as falls, touching the normal in between the peaks. So it is going to the high temperature, and also is going to be fall into the less temperature. So this is going to be commonly observed. So this type of fever is called as intermittent fever. Most commonly, we can found this intermittent type of fever in case of malaria. So if you see, maybe the person may won't get the body temperature rise in the morning times, maybe it increasing in the evening time. So this is the classical like a clue to diagnose to rule out the what type of the fever in which condition. And also presence of the chills and rigors suggested rapid rise of the blood temperature as occurring in malaria and also pyelonephritis, pus collection somewhere in the cholangitis. And also is maybe because of the bile duct problem, or is in case of the pyelonephritis, the nephron having the pus formation or accumulation of the pus. So this is the indication for the infections. So that means if anybody having so any pus form, any infection, severe infections, or any inflammation in the bile duct systems. So this is going to be high temperature. So it's because of the chill and rigors. So they are going to feel more cold, like a sensation, and also like if they go to the any like a in the less than temperature is minus degrees, how they are going to feel. So they here also they are going to feel that much of temperature. So most commonly because of the infections, the temperature may increase. And also periodicity. So periodicity means, so why we have to know about the period, how much of time the fever is going to be occurs. So that means in which conditions it may alter. So just now we discussed the different type of the patterns. There is a continuous and also remittent type and also intermittent fever. So these are going to be something continuous and also something that is going to be I raise the temperature and fall the temperature, and maybe difference between the temperature minimum and maximum is going to be less than 1 degree 1 centigrade, and also if more than 1 centigrade also may observe in the remittent fever. So if in the case of the periodicity, so this one we have to check. So how much period person having the temperature, in which condition is going to be increase the temperature, or how often they are going to get the temperature. So these things we have to observe. So during the like recording the body temperature. So if any person comes with the fever, so that means we have to observe. So when, how often they are getting the fever? Is it every day? Or is there any alternatives in the morning or maybe in the evening? In the morning is the normal temperature. If it is increasing, in the evening, if the body temperature is increasing. So we have to check. So this type of like a patterns or periods, so we have to observe while giving the treatment plan. So normally, if anybody having like a typhoid fever, so they are going to get the everyday fever. So that is called as a quantitative fever commonly seen in it. So this one is going to, they are going to get the fever every day. So most commonly in the typhoid and also thalassemias. So this one is the, sorry, leishmaniasis. So this one is a parasitic disease. So the phlebotomine sandflies. So because of the bite of these flies, so may chance to get the fever. So this is the everyday they are going to get this everyday like a continuous fever. We can found it. And also some patients may chance to get the like every fourth day they are going to get the fever. And this one also is going to be within the fourth day or within the intervals of the 2 days, they are going to get the fever. So that is called the quarantine fever. So most commonly seen in the Plasmodium malaria. So they are going to get the every fourth day or maybe in between 2 days intervals, they feel the fever. So in case of the Plasmodium is a vivax, malaria also we are going to see the alternative day fever is going to be can observe. So how much the period we are going to, so how the period is going to be changed according to the cause two factor. So coming to the pale Epstein fevers. So this pale Epstein fever is going to be the cyclic manner. So sometimes is going to get the normal fever and other time is the high fever. But this one is going to be is a alternate. That's at least minimum the period will be 3 to 10 days. But alternate sometimes is the afebrile, that is the no temperature, less temperature, and also is going to be the raised temperature. So this is commonly seen in case of the Hodgkin's disease. So Hodgkin's disease nothing but is the lymphatic system disorder, one type of like a lymphoma, nothing but is a lymphoma. It's a like a one cancerous type in the lymphatic system. So most commonly seen in this type of symptoms in the Atkins disease. So coming to the hyperpyrexia and also hyperthermia. So what is the difference between the hyperpyrexia and also hyperthermia? So both are nothing but is the same, is the temperature is raised, is more than 41 degrees centigrades. So that means is the, more than the 104 degree Fahrenheit. So that is a severe fever. So that is called as hyperpyrexia. It results from the setting of the hypothalamic thermostat to a higher level or loss of control of the thermoregulatory mechanism. Our body temperature regulated by the a structure which is called in the hypothalamus in our brain. So if any abnormality in the hypothalamus, so the body regulatory mechanism is going to be altered. So because of these things also, the body temperature is going to be raised. So that is in case of hyperpyrexia. Pyrexia means the fever. Hyperpyrexia means the high, more than like a, normally we consider 37.7 means we consider fever. So in case of, if it is crossed the 41 centigrades means a high fever, in those conditions, the people may chance to get the severe complications and sometimes it affects the brain and also may chance to get the convulsions or seizures. And if severe complication, they may chance to get the mortality also. And also it may observe in severe infections, intracranial hemorrhage and heat stroke. So in case of any infection, severe infections after the temperature is going to raise more than 41 degrees centigrade. Intracranial hemorrhage, that is the if any bleeding inside the brain because of the bursting of the blood vessels, or maybe because any tumor or because of the high blood pressure. So many reasons are there. High blood pressure. So if any hemorrhage, any bleeding inside the brain, so it may use the hyperpyrexia. If there is uncontrolled production of the body heat exceeding the ability of the body to despite, it is the hyperthermia may result. So if it is not controllable, if the hypothalamus is not controllable, so it's going to be because of the hypothalamus abnormalities or any hemorrhagic, so it may use the hyperthermia. So it's hyperthermia is a medical emergency with a high mortality and morbidity. So if they increasing the high temperature, it's not controllable. So it is they may chance to get the mortality and morbidity. This condition has been anticipated and managed effectively to save life. So that is the reasons we have to diagnose properly, differential diagnosis. The fever, why the fever is the alternative days, why the fever is high, more than 41 degrees centigrade. Why is going to be suddenly fall the temperature and suddenly raise the temperatures? So if you understand the mechanism of the body temperature, so we can rule out the causative factors. According to the causative factors, if we give proper treatment, so we can prevent the mortality and morbidity. So if you see how the temperature is going to be raised and also how the temperature is going to be fall, so we have to observe here. So is maybe, so these are going to be two types of the fall down. So that one is called as the crisis, another one is the lysis. So the crisis means this refers to the abrupt fall of the temperature from the 40 degrees centigrade to, and also subnormal, below the normal level, the temperature is going to be fall suddenly. So this is maybe because of the, if you see here, the sudden, if you see here the temperature, you can see the blue line. So this is going to be like a temperature is near to the 40 degrees centigrade, that is 39 points. And also here the temperature is going to fall below the normal temperature. Normal temperature is the 37 degrees, but suddenly is going to fall within the 1 day. So you can see here the temperatures fall below the normal temperature. Then again is going to continue until the normal temperature. Below the normal temperature after 2 to 3 days is going to comes to the normal temperature. So this type of body temperature so is the falling and the variations. So we called as the crisis. And also about the lysis, so here is going to be the temperature falls is the step by step. So that means it comes to the 99.2, 98 and 97 and also 98.5, 98, 97. So slowly again slowly raise and down and slowly raise and down, and it comes to the normal temperature. So this type of temperatures commonly seen in the typhoid, but and this and also this crisis is going to be associated with the diaphoresis, that is a severe sweating, and also diuresis, that means the more like urine formations, and some cases there may chance to get the diarrhea. So in these symptoms also going to be accompanied with the crisis. Lysis is going to be it's commonly seen in the typhoid fever. So these are the variations in the fever. And also, what are the patterns? So if you understand clearly, so we can get some clues about the diagnosis, proper diagnosis. So how to find this type of clues? So if you understand about some mechanisms, so we can easily get the clues. According to the clues, we can diagnose properly. So for example, is a pneumococcal pneumonia. So how they are going to get the fever? So that's going to be abrupt onset and continuous fever, and also fall by crisis. So that means sudden fall of the body temperature. So they are going to be commonly seen in the pneumococcal pneumonia. The temperature is going to be rise suddenly and continuous fever, and also the temperature also going to be fall suddenly. So this commonly seen in the pneumococcal pneumonia. And also in case of typhoid, the slow onset is going to be, the temperature also going to be slow onset with the step ladder pattern. Step ladder means one step down, so slightly temperature is reduced, then slowly up and rise low and up. So it's going to be altered. So most commonly seen in so typhoid fever, the symptoms are going to be appear like a lysis. So it's going to be step ladder pattern. In case of Plasmodium vivax malaria, so in this plasmodium like a malaria fever is an intermittent fever. Is a terratin periodicity. So that means maybe in the morning the temperature is low, but if it's they reach to the evening, the temperature will be high. So because of the malaria is going, the plasmodium malaria is going to be, activity is going to be changed according to the maybe the time, and also that means the temperature. So it's going to be altered. So it's going to be is the intermittent fever. So one time is going to be high, so another time is going to be low. And also administration of the antipyretics At the commencement of fever, altered pattern of the abolishes and its diagnostic values. So that is the important if it's any type of the fever. So first thing is, so if they take the antipyretic medications such as the paracetamol, so this going to me, so it control the some symptoms at least. But after that, we have to find out the what is the causative factor. So according to the causative factor, if they take the medications, so we can control the mortality and morbidity. And also next one is the general is accompaniments of the fevers. So what are the other problems are going to face along with the fever? So this going to be the basal metabolic rate is going to be increased. So excess catabolic activity leads to the rapid loss of the weight. So that's one reasons. So if anybody get fever continuous more than 10 days, if you observe those patients, they're going to lose their weight. So because of the excess catabolic activities. And also this is aggravated by the diminutions in the food intakes, which is caused by the loss of appetite, which is a common is accompaniment of the fevers. So if anybody fever, so because of the body changes, physiological changes and metabolic rate increased, and also other is catabolic activities, so they are going to get the is anorexia, that is a loss of appetite, and also they are not feeling to take any food. So because of the improper intake of the food, so they are going to get the weight loss. And also next one is insensible fluid losses are going to be increased. The patient tend to get the dehydrated. So here is going to fluid loss is going to be increased. Why? The body temperature is going to raise. Because of the body temperature, the fluid water is going to be absorbed more. So in those conditions, so those people are going to get the dehydration. And also if sometimes the fever is going to be rise and also fall, so that time there's going to give the diaphoresis, increase the sweating. So because these problems, the water loss is going to be more, it may lead to the dehydration. Sometimes because of the dehydration, the person may chance to die because of there is no water content. So and also imbalance of the electrolytes may chance to get the mortality. And also heart rate also going to be increased. At the rate is 8 counts per minute for every 1 degree centigrade rise of temperature. So if the, for example, normal temperature is the 37 degrees and also 37.4, if it is crossed more than 38, so every 1 centigrade, the temperature, the heart rate is going to be 18 counts. For example, normal temperature is 100, like a 70 to 80 beats per minute. If it reaches to the 38 and 39, so every 1 degree centigrade, heart rate is going to be increased the 18 to 20 times. So this is the associated features of the fever. So this results in the increased rate of the SCA node. SCA node is the sinoatrial node. So this is the pacemaker of the heart. So this SCA node gives the electrical signals to the throughout the heart muscles. So that means conducting system starts in the SCA node. The electrical impulses starts in the heart. So they, because of the body temperature rises, so it's going to give them more like a heartbeat is going to be increased. And also what are the other associated features are respiratory rate. Respiratory rate also going to be increased. In general, the ratio of the respiratory rate is to heart rate is around the 1:4. Normally is the normal heart rate is the 80 beats per minute. Breath rate is going to be 20 times as a normal, 12 to 20. So this is the normal. So always is going to be the 1:4. Is the 1 is the breathing and also 4 is the heart rate. Respiratory rate increases in the fever along with the heart rate. Always if the increase in the heart rate, automatically respiratory rate also going to be increased. Abnormal elevation of the respiratory rate out of the proportion of the heart rate occurs in the respiratory diseases such as the pneumonia and pleural effusion. Pneumonia is going to be the infection to the lung, and also pleural effusion, any accumulation of the fluid in the pleural cavity, the surrounding covering layer of the lungs, so may chance to get the abnormal heart rate as well as respiratory rate. So another symptoms associated with the fever, the rashes. So most commonly, if anybody having like a severe infections or any inflammations or because of the any other disease progressions, this is going to be the side effects or maybe is associated with the high fever. So these are the eruptions occurring over the skin, mucous membrane is may of them are associated with the fevers. So rashes are associated with the fever in many conditions. So if anybody get the fever with the rashes, so this is the that means diagnostic procedure is very very important. So this rash maybe is a macular, papular, vesicular, and also the pustular, hemorrhagic. And also this is going to be different type of the rashes. So where we are going to sometimes there which looks like the bleeding and also papule-like or vesicle type, or some things are the, like a fluid is going to be inside the like a rashes. So we can find different type of the rashes in the different type of the conditions. So this fever is characterized by occurrence of the rashes over the skin are called as the eczematous fever. So if any fever associated with the rashes, so that is called as xanthomatous fever. So this is called as xanthomatous fever. If the rashes occurs in the mucous membrane, is called as the is a anthemas. So anthemas is going to be the if any in the mucous membrane. So the distribution of the rashes and the time of their appearance are is a different characteristics. So when they're going, how the distribution is going to get, and what the other characteristics of the skin rashes. So if you see here, the first day of the fever, so it indicates if anybody fever and also rashes occurs, the first day itself, so we can get the clue. So it is maybe because of the chicken pox. Second day of the fever, so is a scarlet fever. So if because of the some insects bites, so this may chance to get the sore throat and also along with the fever and rashes in the second day is commonly seen in the scarlet fevers. And as next one, third day, if it is the small is going to be appearance of the rash on third day, it is called as smallpox. But most probably nowadays is the smallpox is not available. It's already eradicated. So I think no, most of the countries are there is no smallpox now. After we got the advanced vaccinations, so there is no smallpox until now. But if anybody get the rashes, previously the clinicians has to found that this the third day rashes are indicating the smallpox. If anybody get the fourth day, rashes are indicates the measles. And fifth day is going to be the typhus. Sixth day will be the typhoid. And also is usually yes, like a red spots is commonly seen in the typhoid. The appearance is going to be a little bit different. And also is going to be is early administration of the antipyretics and other drugs alter the natural history of the disease. So that is the reason. If anything causative factor, if they are having high fever, high temperature, the first main foremost important thing is we have to give the antipyretic medications, such as like a paracetamol. And also next one is the rashes may also be due to adverse reaction of the drugs. Sometimes, if for example, fifth day or sixth day, if they get any rashes, we have to think about the typhoid, or otherwise we have to think about the any like a what is the treatment plan which he got. That means in the initial day, first day to until the fifth day, what medications he got. Sometimes these medications also may use the side effects which produce the like a rashes. So here I'm going to give some different type of the rashes so we can easily rule out the what are the different type like in which conditions. So for example, is a caplic spots. So these are going to be the are bluish gray spots occurring inside the cheek, opposite to the upper second molar. So this is going to be the in commonly seen in the diagnostic. So if you see here, is going to be the like a grayish spots inside the cheeks. So inside the cheeks, if you open the cheeks, so we are going to found so this type of the spots. And also these are very very important. And also is the next one is the maculopapular rash. So it's over the butterfly area of the face is highly suggestive of the systemic lupus erythematosus. So you can see here like a butterfly appearance is going to be the butterfly appearance area. So it's going to be, so it may appears on the chest or back, so all the places. And this is indication of the systemic lupus erythematosus. So the fever is there and also butterfly appearance. So it indicates the systemic lupus erythematosus condition. And also next one is the erythema marginatum in the rheumatic fever. In case of rheumatic fever, so it's a coppery rash in secondary, in commonly seen in the secondary syphilis, hemorrhagic rash commonly seen in the meningioma. So if it is the appearance like this hemorrhagic one, we can commonly seen in the meningococcemia. So that means we are going to find the different infections produce the different type of the rash. So in case of erythema and also chromium margins, so this is going to be seen in the Lyme's diseases are only few of the many examples. So we can found the different rashes in the different conditions. If you understand, so which rash is commonly in the which conditions, so we can easily diagnose the a problem, and also treatment will be easy, and we can prevent the mortality. So these are the some pattern. So this is very important during the clinical examination, the diagnostic pattern. And also next one is coming to the mouth. How the mouth is going to be changed during the fever. So different type of the mouth also is gives the clues. So what type of conditions? For examples, this just now we according to our last in the discussions, they may chance to get the hepatitis loss. So anorexia they're going to feel. So because of hepatitis is going to loss in most fevers, and also intake of the food and fluids come down. So the mouth become dry and also coated. If you eat and drink everything, so those people won't get the any coating or any on the tongue. So if you see from morning to evening, so we are walking, we are going to have food and have drink something. So if you check, you won't get any any coat, any this material we cannot observe in the during the daytime. If you wake up in the morning, you can observe, so before brushing, you can feel the some coating on the tongue. So what if you are not taking the food? So the bacteria and also virus is going to be, so whatever the material is going to be, what we had also is going to be like a deposit on the mouth. So on the tongue. So this is most commonly seen in case of who already having the hepatitis loss, or if they're not taking the food properly. So this is the presence of the dried up the debris over the teeth, or at the level of the lips margin is called as the sores. So it's commonly seen in who already like a loss of appetite, or if they're not food, the tongue become dry and mouth is going to get the dry. So it may use the debris formation on the tongue. And also the pattern of the coating of the tongue may be characteristics. So in typhoid fever, the tongue shows the central coating. So in the central coating, we are going to found only centrally here. So that means the surrounding you can found here, the surrounding is going to be the periphery is there is no coating, but if it is originally there in the center, it indicates the typhoid fever. In many cases, tongue may shows the other changes, not only in the typhoid, in many others like a high fever. So these tongue coats are going to be altered. So in the typhoid, is the center is going to be the degree formation, and periphery is going to be the clear. So this type of more common symptoms associated with the typhoid fever: high fever, continuous fever, and also the rashes, as well as this tongue is going to be coated with the debris. So these are going to give the clues. And along with if you have the diagnosis like investigation process like a blood analysis, so we can found that typhoid like a virus salmonum type. So this one is going to be so we can found in the investigation, we can diagnose clearly in the, we can like a enteric fever also called as typhoid fever. And also soreness of the tongues we can found in the measles. So if you see here, so it's going to be this like a source. It's going to be rashes, like appearance. It's because the blisters are going to be like the eruption it may chance to get. So these conditions may found in the measles. So and also is a coplic spots, and also like a rashes, and this type of symptoms commonly seen in the measles. And next one is the red beefy tongue. So it's because of the, in case of side effect of the spectrum of the antibiotic therapy. If anybody use the antibiotic for a long time, so they may chance to get the tongue become the like a red appearance and also beefy tongue. So how they are like a very thick as well as it's going to red appearance. So this is the side effects for the broad spectrum antibiotic therapy. So coming to the other complications in case of like a in the different conditions, the tongue is going to appears in the different shape, different appearance. So the white curdy membranous over the tongue is easily removable. So and also this is due to candidiasis due to prolonged broad spectrum of the antibiotics. So because of the prolonged use of the antibiotics, also they may chance to get this white mucus, and also this is coated with like a debris over the tongue. So in case of the like a prolonged duration of using of the antibiotics, corticosteroid, and also immune suppressor states. So just recently, according to like a surveys, because of the pandemic situation, many patients use the corticosteroids to control the infections. So after using the prolonged usage of the corticosteroids and antibiotics, so many people complained after the this COVID-19 like a subside, like if it means they control the symptoms. After recovery also, many people complained about this type of symptoms because of the prolonged use of the corticosteroids and also antibiotics. If the, I mean, immune suppressed states, the immune less, so they may chance to get the debris formation, the white mucus formation on the tongues. And also is going to be ulceration over the tongue and also bleeding. So they are going to get the bleeding and also ulcer and also wound-like appearance. So it's going to be found in the Stevens-Johnson syndrome. So in most common, so they are going to do the bleeding as well as the tongue is becomes coated and also ulcerations may form. And also in case of HIV and also the immunosuppressions, if anybody have like a immune deficiency, so they may chance to get the tongue is going to get like a thrush, like a fungal infection. How they're going to in the fungal infection, how they feel, the same things are going to be observed in case of like a HIV patients and also immunocompromised patients or immunosuppression patients. And also other problems with the associated with the fever. So how the changes in the urine and also feces. So if you see the urine volume comes down as a result of dehydration. Just now we discussed, because of the temperature, water is going to be reabsorbed. So water content is going to be reduced because of the intake of the water is also going to be decreased. And high temperature, because of the body temperature, water is going to be reabsorbed. So may chance to get the dehydration. So if there is no water content, so there is also improper filtration of the fluid. So may also will give the less amount of the urine. So that is the reasons the urine will be is high concentrated and also high color. So it may be depends upon their diet and depends upon the medication. So it's going to be altered. And also if you ask the person or if you identify the smell, the odor, and that means the order and also color, the quantity, everything is going to be changed because of the dehydrations. And sometimes they may chance to get the like a because of dehydration they may won't get the full emptying, they won't empty the full bladder, only they're going to be less amount of urine they're going to be empty, so that time they may chance to get the burning sensation too. And also, along with the urine, the feces also going to be the main chance to get the constipations. So this constipation means unable to pass the feces at the waste materials, so unable to toileting. So because of they may chance to get the water content is going to be decreased, food intake is going to be decreased because of the dehydrations and because of the physical activity. So all are going to be associated with the fever. So if no water intake, proper water intake, the water is not going to be absorbed clearly. So there's going to be complete absorption is will be more. So no, there is no fluid in the waste material. It's difficult to pass the fluid and also decrease the physical activities also. It won't give much the intestinal movements. And also next about if there is no proper food intake, so they won't take the like a we won't get the waste. That means should metabolic the metabolism should be there. Whatever we take the food, the nutrients should go to the bloodstream. The remaining waste material should come to the digestive end of the digestive system. So if they have the like a fiber rich food and also healthy food only, they are going to get. If taking less amount of the food, less amount of the water, less physical activities, so all are going to be is make the like a condition will become to the constipation. In case of typhoid fever, so and also bacterial dysentery, diarrhea may occur. So sometimes fevers also may associated with the bacterial infections. So those people are going to get the dysentery, diarrhea may occur. So is a frequent passing of the stools or feces formation in the liquid formation. So these things are so is a, one of the dangerous the sign in case of the like in a typhoid fever. If the fever is associated with the diarrhea, fever already produce the dehydration. Okay, because of the dehydrations, they may won't get the urination and also fecal like a material passing out. And also, if the diarrhea, sometimes with a combination of the dehydration with the diarrhea, there also is a frequent passing the stools within watery consistence. So if they loss of the water content through the like diarrhea, the diarrhea. So what happened? The body is going to lose more water content. Whatever we take the water, everything is going to, because of the high temperature, as well as the feed is the diarrhea. So it's a loss of water is more. So if it's a water loss more, so they may chance to get the imbalance of the electrolytes. So it's either calcium, it's a potassium and also sodium. So minerals, all this going to be, they are going to lose. So these are the very, very important for our heart muscle functions and our muscular contractions and also heart muscle function. So sometimes because of the loss of the water content may alter the electrolyte balance. So this leads to the, sometimes the person is going to be die. So that is the major complication in the, if any person having fever along with the diarrhea. And also that's the time. So you have to examine the urine and feces microscopically. If it is available and mention any abnormalities, noted along with the general examinations. So if the person complain anything related, as soon as possible, okay, we have to advise them for the investigations. So along with the lab investigations, physical examinations, and also with along with all these combinations, so we can rule out the causative factors. According to the causative factors, plan the treatment plan, and we can prevent the mortality. And also coming to the, what are the causative factors for the fever? So many causative factors. If, for example, in our body, exposed to anything also, our body is going to respond. So the response is the fever. So you can see in the different type of the causative factors, we can found. So infections, inflammatory causes, and also hypersensitivity reactions, if any trauma, and also extravasation of the blood. So also may chance to give you this fever symptoms. So first one is the infections. So this is the commonest cause of the fever in all the countries. So fever is the common, for example, if it's an infection with the bacteria or virus or anything also, the most common sign and symptom is the fever. Especially in the developing countries, and also this infection is more, not only in India or China or Malaysia or USA, so all the countries. So it could be the bacterial, viral, and also rickettsial, chlamydal, protozoal, fungal, and also helminthic. So all the parasites, bacteria, fungus, and fungal. So all the big cause organisms are going to produce the fever. So almost all infections cause the fever as the general reactions. Is there either bacteria or virus, fungus, or anything also? It's going, or helminthic parasites. So all are going to produce the symptoms. That is the most common symptom of the infections is called as fever. And also next one is the inflammatory causes. Inflammatory causes are is not attributed to the infections. So in case of connective tissue disease, so such as the SLE, systemic lupus erythematosus, and also rheumatoid disease, rheumatoid arthritis or rheumatic fever. So these are all related to the inflammatory. So after infection, the system is going to be altered, and also it may becomes the swollen. There is so many changes in, maybe you can learn in the pathology what are the changes in the inflammatory. So if any get inflammatory, the foremost common symptoms are the pain and redness, temperature is going to be raised, and also tenderness. So these are the cardinal features, important features of the inflammations. So most commonly, because of the swelling, so in most commonly in the systemic lupus erythematosus, so they are going to get the fever and also inflammation, joint pains, as well as rashes all together. So these are the most common causative factors that is produce the symptoms. Hypersensitivity reactions. So hypersensitivity reactions means, so is going to be any reactions to the any drugs. So anti-seras are biological products, serum sickness. So that means because of the any drugs, if any interactions with the our body, so is going to produce the fever. And also another causative factors is the trauma. Trauma means is the accident or any blunt trauma, and also major surgery is accompanied by fever. For example, in case of any surgery also, if anything cut in our body, so body is going to react. So if any surgery procedure also is going, nothing but is a trauma, is going direct trauma on the body. So it also maybe is accompanied with the fever. Even in the absence of infective complications, if there is no infections also, sometimes after surgical procedure, so may chance to get the fever. So these are the one of the causative factors. So if you know that if any person undergone for surgery, in the next day or maybe if any infection, along with the infection or without infection, also may chance to increasing the body temperature. So this is the commonest cause of the fever also. And the next one is the extravasation of the blood into the tissue spaces gives rise to the fever. So that means if any blood into the tissue spaces also, so if anything happening, so may also chance to get the fever. Any entry of the any bacteria or virus, anything foreign materials, if they rise, if they enter into the bloodstream, so it may give the uh, a fever. And also neurological disorders. So especially neurological disorders are going to be brainstem may gives rise to the high fever. So especially is the pontine hemorrhage. In case of any like a bleeding inside the midbrain. So if you see the midbrain components of the the brainstem, midbrain, pons, and medulla oblongata, if any bleeding inside or if any like a intracranial tumors or any hemorrhage also, it may alter the function of the hypothalamus, and also it may produce the like a it alter the body regulation, body temperature regulations, so may chance to get the high fever. So coming to the endocrine causes. So these endocrine causes are especially the hyperthyroidism. Hyperthyroidism means so increasing the thyroid hormone. So this hyperthyroidism also may produce the high body temperature and thyroid storm and ovulation also. So these are the cause, like in the ovulation period also, the body temperature is going to be raised. So the normal physiological changes during the after menstruation, in between the menstruation, the midday of the when the egg is going to releasing time also, the body is going to be hormonal changes, will get the hormonal changes, and also they're going to get the high temperature. And also in case of physical agents, heat and also hyperpyrexia. So if the brainstem and also if the hypothalamus is not controlled properly, and also if it is not there, if there is no regulation, so the body is going to get the hyperpyrexia. And also if it is exposed to the heat, so if anybody having like a room in the hot temperature, or maybe is a irradiation fever or dehydration fever in infants and children. So and also other factors. So these physical agents also, if they stay in the very hot object area or maybe the sunlight, high temperature, also may chance to get the high fever. In case of dehydration, so the fever in infants and the children. So because of the dehydration also, they are going to get the high fever. If there is no water content in our body, the body is going to completely reabsorb the water from our body. So this temperature is going to be raised. And coming to the neoplasms. Neoplasms means cancerous. So abnormal growth of the tissues or cells, so may produce these neoplasms. So several neoplasms such as the hypernephroma and also primary carcinoma of the liver gives rise to fever as early manifestations. So especially is the nephroma. Nephroma means is a nephron, is a kidney cells. If you see any structure in the kidneys, nephron is there. That is the structural and functional unit of the kidney. So if any oma is a cancerous cells formation in the kidney, so may chance to give the increasing the body temperature. And also if any liver, if any liver get the tumors or cancerous, is it the malignant tumor or benign tumors, also producing the fever for the liver symptoms. In acute leukemias and also lymphomas, fever is the most common symptom. Acute leukemia or blood cancer and also lymphoma, and also is the lymphatic system tumors such as Hodgkin's disease. In Hodgkin's disease, this lymphatic system is going to be affected, and also it may give the symptoms such as the high fever in case of neoplasms, either is a tumor or tumor in the liver or lymphatic system. So most commonly, this is the commonest symptom in all the affected areas. So and also moderate to severe hemolysis and also reabsorption of hematoma from any site may give rise to fever. Hemolysis, any breakdown of the blood cells, so RBC, so any like a breakage of the RBC, this may produce the fever. In case of the blood abnormalities, may give the high fever, or also maybe hematoma, or also reabsorption of hematoma also may give. Hematoma means a blood clot. So it's a disappearance of the blood clot or maybe it's traveling in the bloodstream, so also may raise the body temperature. And in case of the severe muscular efforts, severe muscular effects like a convulsions, like a fits or seizures. So if any abnormality in the brain, so our brain is going to give the hyperactivity symptoms. So they are going to get the fits, nothing but the fits or convulsions. Especially status epilepticus. Status epilepticus means is a continuous epilepsy, continuous fits. So may chance to get, so there is no like a gap between the one episode to another episode, is continuously is more than 3 to 2 to 3 minutes. So it may gives the body temperature is going to be raised like a high muscular contractions. So because of they're going to get the shivering, so they may chance to get the high like a body temperature. And also in case of tetanus spasms, and also severe exercises in the closed, if there were workout during the closed space, that means a severe exercise, a strenuous exercise, weightlifting, or maybe HIIT training, like a high intensity interval training, or maybe aerobic activities. So it also may use the like a body temperature is going to be raised. So that is a normal mechanism. But in case of tetanus spasm means in case of tetanus infection. So that means if any cut or if any infection affected, if they're not cured properly, so the tetanus is going to be affected. So it may give the other complications. It may affect the other parts of the body. So it may give the severe sepsis. So those conditions also they may chance to get the severe fever. And also next one is a factitious fever. So it means is produced the artificially and not by the genuine process. So that means sometimes while doing the some manipulating, like checking for the any thermometers or maybe any investigation procedures, or this one is going to be. So many is a malingers the printed illness by the manipulating the thermometers so as the record higher temperature. So this is called is a faticulous fever. So sometimes if any defects in the like a thermometers or any manipulations, so also may chance to get the high fevers, shows the high fever. So and also coming to the what are the causes for the prolonged? Until now, we discussed about the so many reasons, either the fungal infection or bacterial infection or viral infection or parasitic infections also produce the all the so many like symptoms are like fever symptoms. But in which conditions this fever is going to be prolonged? For example, like as just now we discussed, in case of typhoid, it may chance to get the more than 10 days, or maybe in the lymphoma, such as the Hodgkin's disease, also it may alter alternative fevers, or maybe it's a prolonged time. Remember the duration within the 3 to 10 days also may chance to get the fever. So, but in which conditions are going to give the prolonged fever? So here we are going to discuss about the prolonged conditions. So in case of the bacterial, so especially the enteric fevers. Enteric fevers means the typhoid, tuberculosis, TB, that is the any infections to the spine, like a spine and lungs, most commonly affect the lungs, and bone also is affected. And also infective endocarditis. Endocarditis means the covering layer to the like a the is affect infection to the heart. So also may use the high fever, prolonged urinary tract infections. So in case of urinary tract infection, also because of urine is the waste material. So if this material is prolonged, stay in the prolonged time in the bladder, so or maybe if any problem in the prostate gland, or because of any ureter infection or any bowel problems, so or maybe because of any bacterial infection, also may produce the urinary tract infections. So this also gives the prolonged like a duration of the fever. And coming to the rheumatic fever, is a rheumatic fever also is because of the systemic involvement, and this may gives the like a continuous fever, maybe more than 10 to 15 days. And also chronic is the biliary tract infections. Chronic recurrent is the bacteremia, collection of the deep-seated pus. If any pus formation in the tissues, also especially subdiaphragmatic, and also is a perinephritic and pelvic and others. So many different type of the conditions also may chance to give the prolonged fever. So if anybody having prolonged fever, we have to understand the so in which conditions having prolonged fever. According to that one, we are going to rule out the fever. And in case of protozoal is the malaria, and also is a hepatic amoebiasis, liver abscess, and also leishmaniasis, trypanomalariasis, so myiasis. So these are going to give the prolonged fevers. So this one is going to be like a leishmaniasis is because of the fly bites also may chance to get the prolonged fever, and also malaria is going to like a falciparum malaria. So and also malarium virus. So depends upon the involvement of the like a virus or bacteria also may chance to give the prolonged fever. So in amoebiasis, so because of the bacterial infection also, so they may chance because of the infection like a food because food poison also may chance to give the this prolonged fever. And also is helminthics. Helminthics, the small like a parasites. So this is going to be gives the pylariasis, cystosarcomiasis. So this cystomiasis. So here also the trinucleosis. So these are going to be also is going to give the like a prolonged period of the prolonged duration of the fever, especially in the helminthic infections. So these are very small like a worms like appearance, but is also may use the obstruction of the lymphatic like in pylariasis is going to give the complications such as the lymphatic obstruction as well as going to give the prolonged fever. And also other causative factors are the connective tissue diseases. Connective tissue diseases is going to involvement of the connective tissues, such as in case of the SL, systemic lupus erythematosus, SLE, juvenile arthritis, and also rheumatic fever. So in case of juvenile arthritis, if any children, normally arthritis commonly seen in the adult and also elderly people, but we can sometimes we can see in the some cases of the children. So that condition is called juvenile arthritis. We can see in the juvenile rheumatoid arthritis and also in the rheumatic fever. So his connective tissue is going to be involved. So those people are going to expose to the like a temperature, continuous temperature. So commonly seen in the connective tissue. And also viral infections. So viral infections, especially like in case of HIV, after HIV infection, if the disease progressions, so they are going to become as a AIDS patient. So in these conditions, immunosuppressions may get and also loss of immune functions and also they exposed to all the infections. So because of the immunity, loss of immunity functions, so they are may chance to get the TB a lot. That means they are going to get the tuberculosis, affects the lungs, and all the systems are going to involve in case of the HIV and also AIDS patients. So in those people, so this infection and also this fever is going to be continuous. So we can think about, we can easily understand if any patient comes with weight loss as continuous fever, and also if it is having the like a cough symptoms. So if like a productive, so these are all these things are clues to identify the condition easily and we can diagnose easily. Hypersensitivity reactions. So these are the drug allergy and also vasculitis. So hypersensitivity, sometimes if they exposed to any medicine or any chemical, so the body is going to give the response. So those people are going to get the prolonged fever. So this is also one of the causative factors for the prolonged fever. And also neoplastic diseases. Neoplastic means like a cancerous diseases such as leukemias, and also like a blood and also blood cancers, lymphomas. There's a lymphoid system is going to be involved, hepatocellular, and also hypernephrema. Hepatocellular is going to be the hepatic, that's liver is going to be involved. The nephroma is going to be about the kidney cells are going to be affected. So these are the most common causative factor of the prolonged fever. So if any person comes to the like a investigation procedures, so if you know the proper history and also proper assessment about the signs and symptoms with the investigation procedures, we can rule out where they're having the exact the complications, the problem. We can rule out, so we can easily diagnose the fever due to the so many reasons. So that is about the fever. What are the different types of the fever? Like, is it a continuous fever or intermittent fever, or maybe is a remittent fever? And also, what are the patterns? How the periodicity is going to be a sudden, like a fall of the temperature, a sudden rise of the temperature. In which condition the temperature is going to be raised, and is the bacterial or virus or prolonged fever? So these are the some discussion about the. So if you understand about these things, and also associated features with the fever, how the symptoms we can observe in the patient, about the urine, feces, and also the tongue appearance, rashes. If you have some knowledge, we can rule out the condition easily and we can diagnose clearly. So then it will be the treatment will be easy to prevent the serious complication. So that's all about the fever and also different types of the fevers and also positive factors. Hope you understand clearly. So it will help to diagnose the conditions. If any patients comes with a fever, it's easy, and also we can rule out the condition. Okay, hope you understand clearly. Thank you very much. See you in the next class with the different type of the symptoms. Thank you.